October is National Breast Cancer Awareness Month, and one way to detect it is contrast-enhanced mammography, also known as CEM. Dr. Brandi Nicholson is here from UVA Cancer Center to talk a little bit about what CEM is. So right off the bat, tell me what that is.
Well, it's a contrast-enhanced mammogram, as the name implies, where we acquire a routine 2D mammogram after we have given a patient contrast in their vein. So they'll first get an IV, they'll come into the mammogram room, and what they'll appreciate is a mammogram image that takes slightly longer because the machine is taking two views, one which is the routine 2D mammogram and the other has that contrast in place, which preferentially goes to masses and hopefully the breast cancer and allows us to see it better.
Okay, so when should you consider getting this sort of x-ray, as it were, as opposed to just the regular mammogram that a lot of us go in and get?
Right, well, there's been a lot of studies about this contrast mammogram recently, and it's showing that it's nearly as good as a breast MRI, which is the test we used to use to help stage breast cancer and screen women of high risk. And although that's still considered potentially our best, most sensitive test, this contrast-enhanced mammogram, looking as good, is a reasonable alternative for those patients. So one reason a woman might be asked to have this exam is if she has a known cancer now, and we want to look at the breast more thoroughly and find any potential lesions in addition to the cancer. If a patient has dense breast tissue, then this can also be a nice adjunct screening tool to help us better appreciate where a cancer might be hiding from us that we can't otherwise appreciate.
Okay, you said it takes a little bit longer. You started to explain that. What is the experience like? Take us through the steps.
So the women would come to our breast center in the West Complex at the University of Virginia. That's where our machine is. When they come into the mammo room, it will look exactly the same as where they have always gone for their mammograms, but the machine has had a little software upgrade. So when they walk in, we'll start an IV. They'll get that IV contrast injection, much like if they would for a CAT scan or a CT scan. And within about 2 minutes, we'll start the imaging. And to them, again, it'll seem very similar to their normal mammograms, except the compression lasts a few seconds longer so that the machine can acquire both of the pictures in one compression. And then to do the entire exam, it's the routine 2 views per breast, much like they're used to. We ask that they stay around for about 30 minutes after that contrast is injected to ensure that they're not going to have any reaction, although rare can occur with the contrast exposure. And then once they're finished with that, they're able to leave. If it's a screening exam, then they'll get a letter in the mail like they do now from a mammogram, letting them know, if it's normal or if we want to do any other imaging.
Sure.
If it's a diagnostic exam that we've asked for, maybe because of an abnormal mammogram or their breast cancer doctors have asked for to help us evaluate their known cancer, then we look at that exam while they wait. And they know right away if we need to do any other imaging like an ultrasound or something to further evaluate. So, they might be in our center about 1 hour.
Okay.
It's
So a little bit longer.
A little longer, yeah.
Sure. All right. Dr. Brandi Nicholson, thank you so much for coming out here today and explaining that for us. Appreciate it. Matt?
Thank you, Sharon.